Folks, I have a big apology to make to a person who asked me a question about a week and a half ago, and I just now had a chance to really record the samples and things. What I'm doing here today, this shows me with a GoPro on my head here, and I should mute some of these tracks so it doesn't make such noise. But uh, there's a fella at Vanderbilt University that does oral surgery, and so he's bought a GoPro Hero 3 Black Edition. I think he has the standard Black Edition, not the Plus. And he's wanting to know how to move his field of view around for doing oral surgery. He wants to wear a GoPro on his head. And one of the two issues he's dealing with, one is repositioning the surgical field, and the other is not blowing out the whites, like what we see here on Nikki. Here's my wife, Nikki. And I tried various different things with the GoPro Hero 3 Black. So two issues here: reposition the surgical field and not blowing out all the, because he has very bright surgical lights. I've shot a lot of surgeries myself, and you see what you're seeing here, total whiteout over portions of the mouth of the actual area that he's going to be operating on. Well, a couple of things I wanted to give him just bits of advice. I've started a sequence here, and this sequence I've made is 1920 by 1080. Two things I would do. First of all, if I'm going to use GoPro Hero 3, is I would shoot in larger than 1080p. 1080p is the way you're going to probably serve this up to people. So I would shoot, if you click on all these pieces of video here, so here's a 1920 by 1080, but most of these I've shot 2704 by 1536, which is 2.7K. And 2.7K is a really great video to shoot in if you can wear this on your head, because it's going to shoot more pixels than what you really are going to need, right? So the reason that's important is, let's take a piece of video like this. I think this 4529. I finally got my white balance settings right so that it looks right. Let's say that you want the surgical field to be right up here in the middle of the screen. You've got a lot of extra pixels hanging on the outside. Now, I've been showing a lot of people how to reposition lately, so it's not anything new for those of you who I'm going to do it when I pull this 2.7K down on the timeline here. I'm going to keep existing settings. I'm not going to let the sequence change. I'm going to keep this a 1080p sequence. So that's what I'm in surgical field. If I clicked on it again, you can see it was 1080p. I'm going to say keep existing settings. So now I have all this extra video here around the outside that's hanging off outside this field of view here. Now I'm going to go to where Nikki's mouth is there, and that's how it looks without the light. I'll tell you how I set the my camera here in a minute. So there, surgical field of view looks pretty good, but let's say I want to center it up. I'm gonna cut this. Actually, I'm not going to cut this video. I'm just going to click on it. I'm going to go up here to effects control, right? I'm going to twirl down the little motion. It's this little thing right here, this little triangle. Twirl that motion down. And then I'm going to just pull left or right here as to where I want that. Now, I would honestly recommend, if there's some way you can put that GoPro in a fixed place where it's not on your head, do that. And, then it stays exactly pointing in the right direction all the time. But the thing you can do here, let's click this little watch button here, and that puts a thing called a keyframe in. So this little thing right here, this tells this where to go if you're moving your head around, right? So let's say I'm shooting this. Do you see where I just moved there? Okay, I'm going to go to this point right here where I moved, and I'm going to click this again. I'm going to reposition. Again, you see all I'm doing is just dragging these things left and right? Now, as I go back, that doesn't move as much, right? I've just changed the field of view again. There again, that's what I've done. Now, I've not changed the scale. I've just changed the field of view. So now I'm going to pull her back over again, pull it back down. So you can add these keyframes, and that smooths out this extra motion that you've got. It actually gets rid of it. Here again, the way it's kind of painstaking doing this. But as you go out of your field of view again, you come back in, and you can reposition again. And now if we go over that little portion there, we see we've taken a lot of the motion out of this. Now the second issue, so that's how you reposition your surgical field. Now, at this point, you've got nice 1080p video. If I click on this and hit the tilde key, that's the key that's above the tab on your PC or just to the left of the numeral 1, then you see you got a really nice piece of high definition video here. Now, good news, bad news time. My friend has a Hero 3 Black. To get this kind of result, the light, the way you want to shoot this, I could not achieve this with my old Hero 3 Blacks. The thing you're going to have to get is the Hero 3 Black Plus. Now, unless I'm telling you wrong, I really think I'm not telling you wrong. I think I'm telling you right here. You're going to have the Plus, because when you go into ProTune, you have to go into ProTune. On the old Hero 3 Black, I don't have all the ISO settings and exposure settings that I do in the Hero 3 Plus. In the Hero 3 Plus, if you go into ProTune and you go and set your ISO at the lowest setting and you set your exposure to -2, then you get this that is not blown out. Every other setting I tried, I'm going to just go to different ones here. This is stuff I tried with the Hero 3 Black, and you see what I'm getting on every one of these. It does not respond to really good bright light. So once again here, you've seen how I would change the surgical field. You're going to have to get a Hero 3 Plus, and so I hate to tell you that, but hey, it's surgery, it's medicine. To do what you're trying to achieve, you want to get the best tool for doing it. I think the Hero 3 Plus would be what you need, or you're going to get these whited out areas. So I hope this helps. Let me know if there's any other questions I could answer. Love to help docs. I've shot probably, I don't know, 300 or 400 surgeries over the years. I've just recently started using the Hero 3s. I can understand why he wants to use it because it's so mobile and easy to mount to his head. But that would be how you would change your surgical field of view, and it's real easy to do. You just need to, you'll have to, like I say, take some pains with under effects control up here, setting your locations here that you want, and those keyframes are sort of the key. You can zoom in here and you can see a little better. You can widen these things out so you can see a little better too. And yeah, the more keyframes you put in, the more of that you do, the less motion you're going to have there, and you can reposition all that. Now, another question you'd ask, of course, too, is scale. Let's say we did want to scale in on this. If you got the 2.7K video, then you can get even closer in, and it's going to look just fine. So there's Nikki's cool teeth. I hope that wasn't too scary for anybody, and that's how I would do what you're asking to do. So peace to everyone. Hope this helps the folks at Vanderbilt University with their surgical videography.